had a little canker sore in my mouth. And it was there for a while, and I happened to be at a dentist, and he just prescribed a little over-the-counter mouth rinse. And he says, that takes care of everything.
She was originally seen by, I think, an oral surgeon who saw something that looked a little funny along her gum line and was watching it for a little while and tried treating it with different medicines, and it wasn't getting better. And finally, they did a biopsy, and it came back as squamous cell cancer. The cancer had originally developed along her gum line, and one of the issues was that the cancer was going a little bit between her teeth and crawling along her gum line. And so for those reasons, her teeth needed to be taken, but the cancer hadn't quite progressed to the point where it was creeping down into the bone. But to be safe, in order to remove the cancer, we need to remove the teeth, the gum, as well as the superficial portion of the bone. I think for her, the key was being surgically aggressive enough to cure the cancer, but not being overly aggressive, and making her function afterwards very difficult. Because I think in her case, some centers would have very quickly just jumped to doing the segmental mandibulectomy and removing part of the jawbone, and that's a much bigger surgery to recover from.
From my first surgery until the time that I got my teeth was about 3.5 years. I looked at my teeth and I just stood there and cried. It was amazing to see teeth in your mouth again where there'd just been this empty hole. You see so many different people to help you through this. You see a nutritionist, and you see a speech pathologist.
The nutritionist partners with the speech and swallow specialist to alter the diet and make sure that they're still getting enough calories. There's a way to present the food so it's still appealing and psychologically satisfying to the patient. And so that also ties into the third part of the team, which is really important, which is the psychologist, particularly in patients like Miss Lucier, because she wasn't a heavy smoker, she didn't have a lot of risk factors, she's normally not the kind of person that would develop this type of cancer. And so if you're not a little bit affected by the cancer diagnosis, that's unusual. So the psychologist is helpful in assessing how well they're going to be able to deal with the impact of the changes related to the surgery and the treatment.
We were taking our 2 oldest grandchildren to the Toledo Mud Hens baseball game. And so we get there, and of course, when you go to a baseball game, you have to have a hot dog. And we're sitting there, and we're biting into our hot dogs, and I cracked up laughing. I just cracked up. And my granddaughter's next to me, and she says, "Grammy, what are you laughing about?" You know, she's looking around, what's so funny? I said, "I'm eating a hot dog." And that was the big fun thing that day, and for a while I would just smile or laugh or just at being able to eat real food again. Dr. Chang is wonderful. He just cares, and I guess maybe it was the very first appointment that I had with him. I'm a hugging kind of a person, and I gave him a hug, and every appointment I have with him, I always give him a hug.